95% of nurses fail this test. A nurse is preparing a sterile field for a dressing change. Which action by the nurse would contaminate the field and require a new setup? Correct answer. Placing the sterile drape so that it hangs over the edge of the table. When pouring a sterile solution into a container on a sterile field, which technique should the nurse employ to maintain asepsis? Correct answer. Pour a small amount of solution into a waste receptacle before pouring into the container. The nurse has established a sterile field at the bedside. A colleague, not wearing sterile attire, reaches over the field to retrieve an item. What is the nurse's priority action? Correct answer. Discard the entire sterile field and prepare a new one. A nurse needs to add a sterile instrument from a peel-back package to an established sterile field. What is the correct procedure? Correct answer. Peel the package open and drop the instrument from a height of 6 to 8 inches onto the center of the field. The nurse is observing a nursing student setting up a sterile field. Which action by the student would require the nurse to intervene immediately? Correct answer. The student turns their back on the sterile field to retrieve another supply. When opening a large, sterile, commercially prepared kit on a flat surface, which flap should the nurse open first to maintain sterility? Correct answer. The top flap that opens away from the nurse's body. While donning sterile gloves, the nurse's gloved dominant hand accidentally touches the wrist area of their scrubs. What is the most appropriate action for the nurse to take?